Hi, today we're going to be performing mouth care of an alert client. These are the steps that you should at least take to get checked off at state. So here we go, we're going to begin. Knock, knock, knock. Hey Terry, I'm Misty. I'm your nurse today. We're going to be performing some mouth care. So what I'm going to do is pull our privacy curtain here. I've already got our supplies gathered. So this should be all that we need to perform our mouth care. We have a towel here. We have our emesis basin with toothbrush, toothpaste, and some water. I'm just going to move the camera just a little bit closer so you can see a little bit of what we're doing. All right, Terry. So I'm going to go ahead and raise your bed so I can reach you. Even though it's not a required step at state, you should make sure that your patient is sitting up, so that way there is no risk for aspiration while you're sitting them up. If they happen to be on a pillow and it's awkward, you can go ahead and remove the pillow while you're doing mouth care. All right, Terry, let's put that call bell so we can reach it. All right, I'm going to clean my hands again. And we're going to put on a pair of gloves. So the assumption is that your patient can participate in some of this care. At state, I believe the patient is going to be at least alert enough to swish the water around in the mouth and spit it out. That's what it looks like in the skill step, so that's how we're going to perform it. All right, Terry, so I'm going to drape the towel across your chest so we don't make a mess. And you've got your toothbrush here. You can wet it in the water. And then you're going to apply your toothpaste. And then what you need to do is to brush all surfaces of the teeth. So you're going to brush the flat chewing surfaces on all, both top and bottom teeth. All flat chewing surfaces on the inside. The flat surfaces on the inside, I'm sorry, is what I meant. And then all the surfaces on the outside. And at this point, you might want to rinse your toothbrush and then maybe apply a little bit more toothpaste. You're also going to need to get the tongue, the gums, and the cheeks. The roof of the mouth. You want to get all surfaces in the mouth. And then I would dispose of that water. Get a fresh cup of water. You could absolutely bring a second cup of water with you so you don't have to wait. And let your patient either spit what is in his mouth out, or you can give him some water so he can swish and spit. And then if he wants to rinse again, of course, let the patient rinse again. You're always keeping your patient nice and clean and dry. Whatever you need to do that. And then once he's done, I'm going to go ahead and take the towel off. This is going to go in the dirty laundry. All of your supplies, of course, are going to go back to the soiled utility area. So I'm going to dump my water. This is a disposable cup, so I'll throw it out. I'm going to rinse my basin if we used it and dry it if needed. A toothbrush was disposable, so I'll throw that out with my paper towel. Put the toothpaste and emesis basin back into the used supplies, wherever they tell you that your used supplies are supposed to go at state. You can move your table out of the way of your client. Sorry about that. And then you can go ahead and remove your gloves. Lower the bed. Back to a comfortable height. Or a safe height, not a comfortable height. Go ahead and lower the head of the bed. And then, of course, replace the pillow if you removed it. There you go, Terry. Make sure your client has the call bell. You're going to clean your hands and exit the room when you're done.